How do you feel about the lecture this morning?
Honestly, a little bit nervous, but I think because we've looked at the objectives and did the pre-reading, I feel better about cardio.
Hey, I'm sorry to bother you guys. Are you guys nursing students by any chance?
Yeah, we are.
Oh, cool. I'm actually interested in joining the nursing program next year. Do you mind if I ask you some questions about it?
No, not at all.
You mind if I take a seat?
Yeah, go ahead.
Alright, thank you. So, how does the program work?
Okay, so
You start your junior year with your 4 core classes, which are history, math, English, and science, which are going to be from August to December. And then you start with your full set of nursing courses in January, which means you will have nursing classes all 4 periods each day.
You also have to commit to attending over the summer, where you'll be spending your time at school and at hospital clinicals, of which you will need to provide your own transportation to get to both the school and the clinical site. After the summer is over, you still continue clinicals and classes into the senior year and finish the first semester of your senior year.
Got you. And you said when we start nursing, we stay here for all 4 periods. What do we do during those times? What do we learn?
okay, so that's a good question. So basically,
From January to June, you start with Nursing Foundations 1 and 2, which includes anatomy and physiology, learning how to take vital signs, basic first aid, and care of the geriatric patient. Some of the skills you learn include making beds, giving medications, bathing a patient, feeding patients, and providing wound care. Then, from June to August, we get into adult health disorders. And from August to December, we continue with adult health disorders and finish off the program with obstetrics, which is mother-baby, pediatrics, which is caring for children, and then move on to graduate transition, which is where we learn to prepare for the NCLEX, make our resume, portfolio, and exhibitions.
Dang, that sounds like a lot of work. How do you guys manage your time like that? Do you have any good study tips?
You should study for at least 2 to 3 hours a day. I would suggest taking notes and reading the chapters beforehand to prepare. For grading, you must maintain a 70% in all subjects to stay in the program, and if you are not successful in maintaining the 70%, you will be removed from the program and will need to choose a different program.
Got you. And before I join the program, is there anything I need to do? Any requirements?
yes, there actually is. So
Before the program starts, you will need to get your vaccines, fingerprinting, and drug testing done. Other entrance testing requirements should be discussed with your high school counselor. Also, you must keep up with your attendance, because if you miss a lot of days, you will be removed from the program.
Got you. And do you guys wear scrubs every single day? Or is that just an option?
Dress code is very important in the nursing program. We have to wear the school nursing uniform every day, including white shoes. You have to have your hair up, and your hair should be of natural color, and you should also always have your ID, which is very important to have in school and at clinicals. No jewelry is allowed except 1 piercing per ear, and no dangling earrings allowed, and nails should be cut short, and no colored nail polish is allowed also.
Speaking about clinicals, what are some things we might see or do during that time? Do we also take blood?
No, we don't take blood, but if you're into blood work, the medical assisting program is really good for that.
okay, so as far as what we're gonna see in clinicals,
You're going to have to bathe and clean patients, real people. So you have to be okay with bodily fluids and interacting with not only the patient, but also their family. You are also going to see people at their worst times, so be prepared for that. You also give insulin, administer medications, do wound care dressing changes, and educate the patients, as well as much more.
And after we're done with the program, do we get like a certificate or something?
Yeah.
Once we're done with the program, we receive a certificate of completion, and then we take the NCLEX, which is the board exam that gives us the actual LPN license.
Say I've passed the NCLEX, can I start working anywhere?
Yeah, you can start working in a clinic, nursing home, or possibly a hospital. There are many jobs you can work as an LPN.
Alright, thank you guys so much.
You're very
you're
welcome.
welcome.